Welcome to Healthcare Today's YouTube channel. Ankle fracture, one of the commonest fracture of the foot and ankle injuries, and like other bones, the ankle fracture is not so simple. It's a very complex fracture. If we see the structure of the ankle bone, then we can understand. The ankle joint, it forms with three bones. In the upper part, there is a tibia, the long bone, big bone on the inner side, and the outer side, the small bone fibula, and in the lower side, the talus. The tibia and fibula, they makes a cup, and within this cup, the talus, they fits. So if somehow our ankle joint gets stuck and we get twisted, stuck in a position and foot get twisted, then the all force they passes through the ankle joint, and if the force is significant enough, it can cause fracture of the bone. Usually the ankle fracture we known as a malleolar fracture. So the malleolus, medial malleolus, the inner side of the prominent bone from the tibia, the lateral malleolus, the lateral prominence of the bone ankle we can feel from the fibula is a lateral malleolus. So when the ankle fracture happens, these two process, malleolar process, they get fractured. So only this bone not get fractured. When they are getting fractured, the talus bone, they pushes the outer side bone, and it also injures the ligament between the fibula and tibia. This ligament helps to keep the fibula and tibia intact in a position and to develop this, form this ankle mortise, that space of the ankle joint which can match the size of the talus and have a proper movement inside to create the ankle movement. Earlier, all of the ankle fracture, not all, most of the ankle fracture are being treated with the plaster. The fracture can heal with the plaster, but what will happen in long term, in 5 years, 10 years after to this ankle joint? So when the ankle fracture happens with the plaster, we can minimally align those bones, but few things we cannot ensure. One is the length of the fibula. We cannot restore the original length of the fibula, and we cannot restore the space of the ankle joint between two malleolus. It's become very difficult to restore the space. So what happens when you treat with the plaster? This space between two malleolus, they get increased. When they get increased, this talus bone, it moves inside while you are walking, standing on activity. They are not stable, subluxate. When they moves, there is an awkward stress on the ankle joint, on the talus and tibia bone, and the cartilage get eroded and arthritis appears. That's why if we do not able to reduce this bone properly by gaining their length and the orientation and recreate the exact space between the two malleoli, then the joint will develop arthritis very soon. That is the problem of treating ankle fracture with plaster. Very few fractures of the ankle, they can be treated with the plaster where there is no instability. So if there is an ankle fracture, we have to check with different x-rays that is there instability or not. If there is no instability, then those ankle fracture we can treat with plaster. Otherwise, definitely we have to treat this fracture with proper fixation with plate and screws to recreate the original alignment of this malleoli, regain their length and restore the joint space where the talus can sit properly. Otherwise, that joint will develop arthritis and it remain painful forever. I hope this video will help you to understand why the surgery is very important for ankle fracture treatment, not a plaster, and all your misbelief, or I can say your hesitation to get the surgery following ankle fracture, and the doubts will be clear. And if you suffering from ankle fracture, definitely you will take a proper advice from your orthopedic surgeon or foot and ankle surgeon and will take the proper treatment. If this video is informative and help you to clear your misunderstanding and your doubts, please share, like and subscribe our channel. We do care for you.